Hey guys, how's it going? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 28 of my multi-part video series providing a broad overview of the discipline of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. So I'd like to open up today's content by talking about the common hepatic artery. The common hepatic artery courses towards the right to access the superior aspect of the first segment of the duodenum. Here it bifurcates into its two terminal branches, the proper hepatic artery and the gastroduodenal artery. Let's go ahead and take a closer look at these two terminal branches. So the proper hepatic artery emits the right gastric artery before ascending within the hepatoduodenal ligament of the lesser omentum towards the porta hepatis. At this point, it bifurcates into the right and left hepatic arteries. The right and left hepatic arteries penetrate the respective lobes of the liver, with the right hepatic artery initially branching off to provide the cystic artery to the gallbladder. Additionally, the right gastric artery supplies blood to the right portion of the lesser curvature of the stomach, where it establishes an anastomosis with the left gastric artery. Moving on. Let's go ahead and take a look at the gastroduodenal artery. The gastroduodenal artery courses posteriorly to the first segment of the duodenum, where it is susceptible to erosion by penetrating ulcers in this region. It then bifurcates into two branches. The right gastroepiploic artery supplies the right side of the greater curvature of the stomach, where it establishes an anastomosis with the left gastroepiploic artery. The superior pancreaticoduodenal arteries provide blood supply to the head of the pancreas, where they anastomose with the inferior pancreaticoduodenal branches of the superior mesenteric artery, also known as the SMA. Moving on. Let's go ahead and take a look at some questions. During a surgical procedure involving the duodenum, the surgeon identifies a vessel coursing posteriorly to the first part of the duodenum, where it divides into two branches. Which artery is the surgeon most likely encountering? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The description matches the course and branching pattern of the gastroduodenal artery. It descends posteriorly to the first part of the duodenum and then divides into the right gastroepiploic artery and the superior pancreaticoduodenal arteries. Therefore, the surgeon is most likely encountering the gastroduodenal artery. Therefore, the correct answer is F, gastroduodenal artery. Let's go ahead and take a look at why the other answer choices are incorrect. The common hepatic artery does not course posteriorly to the duodenum and does not divide into the described branches. The splenic artery supplies the spleen and does not follow the described course. The superior mesenteric artery supplies the midgut and does not have a descending course posterior to the duodenum. The inferior mesenteric artery supplies the hindgut and is not in the vicinity of the duodenum. The left gastric artery arises from the celiac trunk and does not course posteriorly to the duodenum. Let's go ahead and take a look at another question. During a surgical procedure involving the porta hepatis, the surgeon identifies a vessel that gives rise to the right gastric artery before dividing into the right and left hepatic arteries. Which artery is the surgeon most likely encountering? All right, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. Otherwise, moving on now. The common hepatic artery gives off the right gastric artery before dividing into the right and left hepatic arteries. This anatomical sequence matches the description provided in the scenario, indicating that the vessel encountered by the surgeon is the common hepatic artery. Therefore, the correct answer is A, common hepatic artery. Let's go ahead and take a look at why the other answer choices are incorrect. The splenic artery supplies the spleen and does not give rise to the right gastric artery or divide into the right and left hepatic arteries. The inferior mesenteric artery supplies the intestines and does not give rise to the vessels described in this scenario. The superior mesenteric artery supplies the midgut and does not give rise to the vessels described in this scenario. The gastroduodenal artery is a branch of the common hepatic artery and does not divide into the right and left hepatic arteries. The left gastric artery arises directly from the celiac artery and does not give rise to the vessels described in the scenario. Let's go ahead and move on to the next question. A 50-year-old male presents with abdominal pain and is diagnosed with a duodenal ulcer located on the superior surface of the first part of the duodenum. Which artery is most likely to directly supply blood to the area affected by the ulcer in this patient? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The inferior pancreaticoduodenal artery, a branch of the superior mesenteric artery, supplies blood directly to the area of the duodenum affected by the duodenal ulcer. This artery plays a crucial role in providing blood to the duodenum and pancreas, making it the most likely vessel to be involved in cases of duodenal ulcers. Therefore, the correct answer is D, pancreaticoduodenal artery. Let's go ahead and take a look at why the other answer choices are incorrect. The proper hepatic artery supplies blood to the liver and does not directly contribute to the blood supply of the duodenum. The splenic artery supplies the spleen and is not directly involved in supplying blood to the duodenum. While the superior mesenteric artery supplies the duodenum, its direct branches, such as the inferior pancreaticoduodenal artery, are more likely to be involved in cases of duodenal ulcers. The left gastric artery primarily supplies the stomach and is not directly involved in providing blood to the duodenum. The common iliac artery supplies the pelvis and lower limbs and is not related to the blood supply of the duodenum. That will do it all for the content of this video. If you guys have any questions, comments, or concerns, please feel free to leave them in the comment section below. If you like this type of video, please be sure to leave a like and subscribe for more content like this. That is all I have. So this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Peace.